My biggest challenges with anxiety were in relationship. I did not have any romantic relationships until my mid-20s. I didn't date anyone until my mid-20s.
How I experienced anxiety was in forming close relationships with people. When I would be chatting with friends, it would be very difficult for me to be open and share much about myself. I also found it difficult in the workplace to sort of talk to authority people or my co-workers if there was ever a presentation or anything like that.
Just hit all of a sudden, out of the blue, nothing. I was perfectly happy. I wasn't ultimately very stressed or anything like that.
I had recognized that I was anxious as a child, but it took until my early adulthood in my 20s where my anxiety had gotten to a point where I was starting to withdraw from friends. It was difficult to go to work, and there was a whole bunch of other issues going on.
There came a point with my anxiety where, as I said, it was keeping me up at night. It was affecting my eating and really taking a toll on my health. So at that point I realized it wasn't just a mental struggle, it was a physical struggle as well.
I already knew about it, and then I did some research into some of the symptoms I was experiencing online. I did some research, and then I found that there was a name for it.
I was lucky enough to look up some local resources, and part of that was the word CBT, which up to that point I had no idea what it was. So I did look into it further and did go see my doctor and spoke to him about this program, which was cognitive behavioral therapy based.
The treatment that I received was in a group format, and I found that that was really funny and ironic to get treatment in that way, because that was the kind of very situation that made me really anxious. But it was good for the fact that I was forced to sort of confront it in that environment, which was a safe environment.
The instructors for the course were people who had previously suffered from anxiety problems and had taken CBT programs themselves and managed to overcome and deal with their own problems. So they knew exactly where we were all coming from.
The CBT program that I got into was a one-on-one, which was actually quite good for me.
There are so many tools that are related to CBT, and between both the group session and my private therapist, I had a whole toolbox of things to use.
During treatment, I learned a whole variety of strategies. From the beginning part with just the education portion, finding out that panic and the symptoms and the thoughts and how my body was reacting was completely normal, and that had a really positive effect on my frame of mind, that this wasn't something that I was facing alone.
We also learned how to do relaxed breathing and relaxation techniques, and I use those still every day. Breathing through your abdomen instead of through your chest helped me a lot. I do it all the time now. I only breathe through my stomach.
We went into different relaxation techniques, full muscle relaxations. There's muscle relaxation techniques that I could do at home. I learned some quick techniques so that I could actually do this without anybody wondering what I was up to.
One of the great techniques of CBT is positive thinking and reframing. So while I may never be able to banish all of the worries and cyclical thoughts that I have become much better at viewing things in a positive way.
And then we got into sort of challenging some of the thoughts about whether these were realistic, and jotting some of these thoughts down, which were also important, because I had gotten to the point where the belief that these negative outcomes were going to happen were guaranteed. I was always reacting as though the negative outcome was guaranteed. And just by challenging these, and thinking in a different way, that was also a wonderful tool, getting me sort of realizing that I had an option in my thought, thus breaking this whole anxiety cycle. The next phase of the treatment was exposure therapy, where I would actually list a number of different goals, different anxiety-provoking situations where we could look at it with the therapist and make some decisions on strategically breaking it up so that it would be in manageable stages, where we would bring on some anxiety, but I would stay in the situation long enough for the anxiety to peak and then to subside again.
The theory behind this is that the more times you practice it, the less frightening it becomes. So it's terrifying at the beginning, but over time, it's okay.
All of the therapies, you know, uniquely do their piece, and they're all wonderful tools to stay with you as for life, basically.
After you leave the support network of group therapy sessions or one-on-one sessions with a therapist, of course it is hard to keep up the good practice of using CBT. Old habits die hard. It's very easy to fall back into worry and sleepless nights. So it is a lifestyle change, and I'm prone to anxiety. I don't think that my personality is going to change. I think that's who I am. But I can definitely change my lifestyle and my behaviors and my thinking patterns, and it's something I work on daily.
I feel 100% better. I would, and in fact have, recommended CBT to many of my friends who I know are suffering. It works, and it'll make you feel an awful lot better, and honestly, you have nothing to lose.
My life has changed a lot since I've had treatment. I've found that I have a much larger circle of friends. I find that my friendships are a lot closer, which I had sort of been wanting to have for a long time and been missing out, really. I find that work situations are a lot easier. I'm not judging myself as much when I talk to people, or I'm just sort of, if I do say something that I think's silly or whatever, then I don't beat myself up about it as much anymore.
All I can tell anybody that is contemplating CBT or has anxiety to the point where they realize that it's affecting decisions in their lives, I would say do it, because not only are you going to get on with your life, but your life is going to be so much more rewarding. Overcoming challenges or taking on new goals is wonderful.
Anxiety in my life was all-encompassing. It affected my mental health and my physical health and my emotional health. And the great thing about cognitive behavior therapy is that, yes, it includes cognition, so you can change your thinking, and it includes behaviors. So I was able to stop some of my physical habits as well. But in addition to that, I think there's a spiritual and an emotional dimension in which you feel really fantastic for being able to help yourself. You are not reliant on therapist sessions for however many years. You're not relying on medication to see you through this and to go through these changes. You actually are responsible for the change in your life yourself, and that's really empowering, and it motivates you to keep going.